Reach for the sky. It's the Medicare for the Lazy Man podcast. The only Medicare podcast that actually pronounces the word Medicare properly. Looking a little green around the gills, Medicare expert Doug Jones.
Hello, everybody. Welcome to another episode of the Medicare for the Lazy Man podcast. This is Doug Jones, your lazy man, podcasting to you about Medicare. So the name kind of says it all. I am so happy that you're here because I always like to spread the knowledge about Medicare. The big news is Medicare doesn't have to be a pain in the butt for people. It can be a rewarding and very thorough protection with a reasonable cost for those who follow the right path through Medicare. Medicare does not have to be a place that you're trapped with inferior treatment by medical personnel that are fed up with the low pay that they get, the low reimbursement from Medicare. Not at all. At least that's not the way Medicare is working right now. All you have to do is follow a few specific suggestions that I offer in my book, Medicare for the Lazy Man. Now, the current edition is 2025. So if you go to barnesandnoble.com or amazon.com and type in the search window, Medicare for the Lazy Man 2025, you will have the latest information about enrolling in Medicare, what specific steps to take before and during your enrollment procedure, and how to make the results the finest that you will ever be able to enjoy. In other words, most people covered by Obamacare, most people covered by employer health plans do not enjoy the quality of coverage that they will have under Medicare. And often, not only is the coverage less than ideal, but the cost is higher than it should be. If you're covered by Medicare, the probability is that you're going to have a very, very reasonable annual cost, and that's generally split up into monthly payments. And so you're going to find yourself in very, very good hands if you follow the recommendations that Medicare for the Lazy Man 2025 will share with you. Now, let's suppose you want to pick out your own drug plan. You don't want any irritating, annoying insurance agent breathing down your neck. Well, you can do that by buying my book, Medicare Drug Plans, a simple DIY, do-it-yourself guide. That's available at Amazon.com. Price is about $10 for the paperback. It's about $3 and change for the Kindle version. And you can also get an Audible version. You can get an Audible version in any of my books because I record the content so that you can take advantage of this knowledge even if you are blind. And that is not something that most of my clients will admit to, but I imagine there are a few out there that could really be well served by having content in Audible form. And so that is what I have done. And then I will say to you that the third book, it may be the most useful. It's certainly the least expensive, and that's Medicare for the Lazy Man, Bare Bones. If you purchase that book, you will have a very short but powerful instructional manual as to how to enroll in Medicare and how to persuade your agent, who I hope is going to be me, to get you the best Medicare supplement available in all of the world. And that would be the point of that book. It's such a powerful book that it costs $4.60 for a very small paperback if you just go through the regular channels. However, if you have a Kindle reader, go to Amazon.com. You can get it for $1. I would like to give it away free, but they won't tolerate that. So what I will do is if you send an email to the address that Randy's going to be sharing with you at the end of this episode, I will send you a photocopy of that book free of charge, just to let you know that some things here are too important to be charging money for them. This is valuable knowledge that's very helpful to a lot of people, and I don't want to hold up its distribution. So, with that having been said, I want to turn things over to Randy Carson for his top of the podcast episode greetings to the audience. Randy, would you like to greet the audience?
Greet the audience? Oh, absolutely. You woke me up out of my nap.
I can tell.
Let me get my brain working here a little bit. No, just teasing. I was out working on my arc. As I told Doug earlier, I've got, water probably up to the halfway point of my wall, coming in because nothing ever soaks in out here. You know that, don't you?
Oh, yeah. Well, I've heard experts say that we are in a water crisis because the rivers are not filling up the reservoirs up north. Lake Mead, Lake Powell are both below their maximum capacity. And
Yeah.
that scares a lot of people. Oh my God, what if I have to sell and move out and property values will plummet? And I've heard experts say that back in the olden days when there were like 1 million people here, we used a certain amount of water. Now, with 6 or 7 million people in the state, we use roughly the same amount of water.
Yeah.
So if
Yeah.
that's true, then we really probably don't have anything to worry about in the short term.
No, I don't think we do. Obviously, there's certain things that we have to do different out here, but my yard, as you know, is a total desert landscape, so I don't have
Sure.
to I don't have to water anything other than myself.
Right.
I
And
water
you do that
myself.
with store-bought beer,
I
mostly,
use
right?
store-bought chemicals for that, but bottom line is we have to do some things different. But I was just looking to see how high the water was up on the dike today, and it's a
Uh-huh.
little bit higher than it normally is, but it'll eventually evaporate.
Well, I'm sure it will because summer's going to come at some point, and but it is a crapshoot. Last year in winter, we had a beautiful, warm, sunny winter with almost no rain at all, and it went from fall to spring without any sort of indication that we should bundle up for the winter time. And I always like that, but it doesn't really do much to refill the water reservoir.
No,
So,
no, it really doesn't. So anyway, I just wanted to say hi, and nominally, I guess we should go ahead and try to make some money
alrighty,
today
enough
because
small talk then.
we have to get some more quarters. We have to get some more quarters in the piggy bank.
You would think that doing a few episodes would be worth at least 1/4, but so far I haven't seen that cash flow arise from our labors here. So I'm going to try it again though. So we are going to do our first two segments that we always do, starting with Medicare Minute, Medicare Advantage Minute. And I picked out an article for Medicare Advantage Minute that I really don't know what it's all about, but it has one important element that is makes it special. It makes it special, and Randy will know exactly what I'm talking about. He responds positively when I use the term headwinds. And in this case, it's Medicare Advantage plan member satisfaction facing headwinds. So that's a business school term that somebody came up with to use as a synonym for difficulties, I would guess. And the headline goes on to say, it's one of the longest headlines we've ever had: Digital Innovation and Emerging New Solution, according to J.D. Power. So the content curator has had at it with her yellow highlighter. Let's see what she thought was important in this article. The Medicare Advantage program has undergone significant policy changes during the past year, affecting deductibles, out-of-pocket costs, provider networks, and prior authorization determinations. According to the J.D. Power 2025 U.S. Medicare Advantage study released today, these changes have contributed to increased confusion, lower member satisfaction, and a widespread lack of trust among Medicare Advantage plan members. Wow. I've never trusted Medicare Advantage once I learned what it was all about. So these other people are just joining the party, I guess. Following are some of the key findings of the J.D. Power study. Number one, lack of trust drives satisfaction decline. Overall consumer satisfaction with Medicare Advantage plans is 623 on a 1,000 point scale. That's down 29 points from a year ago. The primary cause of this decline in consumer satisfaction is a 39 point drop in members' overall level of trust in their Medicare Advantage plan. Other factors showing significant declines this year are product or coverage offerings meeting their needs and the ease of doing business. Another one is high performing plans deliver on digital. What the heck does that mean? One key criterion that separates the highest performing Medicare Advantage plans from the lowest performing plans is the ability to engage with members via digital channels. Digital satisfaction among members of the highest performing plan are 98 points higher on average than among those on the lowest performing plans. What's more, 85% of members of high performing plans have used their member portal versus 76% of the lowest performing plans, and 52% of members of the high performing plans find the features or tools offered on their plan's website very easy to use versus 40% of the lowest performing plans. And let's see if the next category is even easier to understand. First year membership satisfaction lags. When new members join a Medicare Advantage plan, their first year often comes with confusion, unmet expectations, and administrative challenges. Only 38% of first year members say that their insurer fulfills their service expectations. That number rises to 45% among established members or those who have been with the same plan for more than 1 year. Common challenges cited by new members include explanation of benefits, how to find a network doctor, deductibles, prior authorizations, and the use of their health savings account or health retirement account. Kaiser Permanente ranks highest in overall customer satisfaction with Medicare Advantage plans in California for a second consecutive year with a score of 675 out of 1,000. Scan Health Plan ranks second, and Alignment Health Plan, 658, ranks third. Freedom Health ranks highest in overall satisfaction with Medicare Advantage plans in Florida with a score of 670. Humana ranks second, and WellCare ranks third. United Healthcare ranks highest overall satisfaction with Medicare Advantage plans in Georgia for the second consecutive year with a score of 648. Anthem Blue Cross and Blue Shield ranks second. So just because these plans rank highest or second or third highest doesn't mean that their members don't feel like they're facing headwinds. They're not all happy because their scores are not up near that 1,000 points. They're down in the two-thirds range, the 650, 670 range. So I would say each of these Medicare Advantage plans, while they may be one of the highest ranked in their state, still they have a lot of members who are not happy. Blue Cross Blue Shield of Illinois ranks highest in overall satisfaction with Medicare Advantage plans in Illinois with a score of 654 out of 1,000. United Healthcare ranks second with a score of 631. And it goes on and on and on. Lists many, many states, many carriers, and Randy has an opinion, so I'm going to stop reading this article and ask for his opinion.
I just wanted to make a small observation. So back when I was in school, my school graded on an A, B, C, D, and F,
Sure.
kind of a process.
Yep.
In my school, anything down around 60% was a D. Okay.
Okay.
And what you're describing, everybody's got, oh, I got 600 points out of 1,000. Guess what that's about 60%. Okay,
Well,
that's a D. That's a D.
I would say your school was a little more lax and lenient than my school was because anything below 70% was a D in my world, and anything around the 60 or 65% was an F. That was F territory.
Oh, yeah, yeah. So I would just want to make that observation because just in case people were getting carried away with the high point returns, don't forget what they used to make you do in high school, people.
What did they make you do?
Get something over 90.
Oh, okay. Yeah. Yeah. Well, that was actually my parents' responsibility. I grew up back in the days when your parents took an active role in making sure that your performance was as high as it could be.
Yeah, well, my parents' active role was, hey, you better get good grades or we're going to take your car away.
Yeah.
So
Well,
I had a really good, benefit. I wanted to get good grades and I wanted to keep my car.
Well, I don't blame you. I wish I'd had a car in high school. I was grounded pretty much because my bicycle weighed more than I did, and it was uphill all the way into town and all the way back from town. So my earlier years, boy, when I turned 16, I was expecting big changes in my life. I was the first out of 5 kids. My parents figured, all right, we're going to make sure that nothing bad happened. So I was in juvenile detention pretty much all the way through high school. I made up for all that loss of fun in college, though.
Oh, that's what I heard. I
Yeah.
think it's still, I think there's still stories about you down at U University of Arizona now.
Well, that was actually the school where I finally buckled down and finished. So there are fewer stories there than there would be from some of the other schools I attended. Anyway, we'll leave the headwinds where they are, and we will go to our second regular segment, which is your Medicare Benefits 2025. This is a list of every damn thing they can think of to do to you that Medicare might consider paying for. And we're in the T's now, Randy. We're sneaking up to the finish line here for your Medicare Benefits 2025. TDAP shots, TDAP shots. And I was going to throw this one away, but TDAP is the booster shot that protects against tetanus, diphtheria, and pertussis. That's where the A comes from, I guess. And then they threw in whooping cough. So TDAP, if they wanted to really be correct about the acronym here, Medicare drug coverage, Part D as in Delta, covers the TDAP shot, not Part A and not Part B. So how about the costs? Well, people with Part D drug coverage pay nothing out of their pocket for the TDAP shot. Part D, your Medicare prescription drug plan, covers all adult vaccines that the Advisory Committee on Immunization Practices, and of course they have to have an acronym. Their acronym is ACIP, that they recommend, including the vaccines for TDAP, respiratory syncytial virus, RSV, shingles, measles, and more. Your Part D as in Delta plan won't charge you a copayment or apply a deductible for vaccines that ACIP recommends. That's the government. If the government recommends it, they're not going to charge you a deductible or a copay. So if you want to know more about this, including how to spell some of these things, go to medicare.gov/coverage/TDAP, that's TDAP -shots. And I'm sure they'll tell you all about it. Now, what do we have available? We have an admonition to review your drug plan, since we were just talking about drug plans. In case the Medicare Plan Finder glitches, well, first of all, I didn't know glitch was a verb. And secondly, I didn't know that it was prone or susceptible to glitches. But according to this is from Diane Omdahl, I'm pretty sure. It's from somebody named Diane, and she's the only Diane I know that writes about Medicare stuff. And it's a brand new article, just a couple of days old. In 2019, an updated Medicare Plan Finder made its debut. Heralding its arrival, the Centers for Medicare and Medicaid Services said it would provide personalized experience through a mobile-friendly, easy-to-read design that will help beneficiaries learn about different options and select coverages that best meet their health needs. Wow, sounds pretty exciting. However, the new Plan Finder was anything but friendly. Let's see. It seems as though the developers paid no attention to the Plan Finder's predecessor. As a result, many valuable features were missing. The new tool did not identify preferred pharmacies, list the total costs, drugs plus premium, for the year, including star ratings, or identify the costs, copayment or coinsurance per tier, to name a few of the shortcomings. And the most egregious omission in my book was not providing a way to save anonymous data. The drugs and pharmacies that are entered without logging into the Medicare.gov site. Over time, the government fixed many of the quirks, but there's still no way to save data without an account. This can create problems for those that are not yet enrolled in Medicare for people who do not want or cannot set up an account, and others who need help but don't want to give out their Medicare number to helpers. Not being able to save the information creates problems in a normal world, but in the midst of a government shutdown, it may create havoc as we work our way through this open enrollment period. Okay, so I think the headline refers to the danger of this thing screwing up in the middle of a government shutdown. And as everybody will know by the time this airs, the government shutdown has finally ended. A lot of people had birthdays during that shutdown, though. Recent problems with the plan finder. Last week, I encountered 4 major problems in one day. Oh, boy, I don't think we're going to want to hear all the details about this. So the impact of the shutdown on Medicare, and then the content curator wrote it ended on November 12th after 43 days. So what you need to know, if you're enrolled in Medicare, create a Medicare.gov account. That way your drugs and pharmacies are saved. Start early and figure out your situation. Maybe you'll find there is no plan that covers all of your drugs. You'll need to discuss alternatives with your physician. And then you could wait until later in November to confirm your situation and enroll in a plan. And the reason for waiting until later in November would be because they tell me, this is Diane Omdahl and her company, all of those people tell me that the plan information isn't always on the website, the government website, when it's supposed to be. Sometimes they're late in providing information and data to the database that everybody taps into. So while you might be told that it's going to be ready to go on October 1st, in reality, it might be a month or more late. As you work through the Medicare Plan Finder, grab screenshots or PDFs to have a record of what you're doing. If you can't get cost or coverage information through the Plan Finder, or if you have concerns about it, check out the plan's formulary. In most cases, you can find this by searching 2026 formulary for, and then put in the name of the plan. You can also try calling the plan, but that's more going to be valuable to you if you speak Tagalog or some of the Indian dialects. If the new plan is the answer, enroll through your Medicare.gov account. Some plans have moved customer service offshore. I think all of them have. As we get closer to December 7th, phone lines heat up and you could be on hold for some time. I will never know what caused these problems, whether the same things happen in other situations or whether the government shutdown has had an impact. Hopefully things will go smoothly for you, but if not, you know what to do. Just review your Part D, as in Delta coverage, by December 7th. So there's a warning from an expert. She is the one who, with her staff, her crack staff, has created the Hey Mo service that I recommend, and I'll give you a discount link if you want to send me an email to the address that Randy's going to give you at the end of the episode. So, okay, I'm always a sucker to try to make the content curator happy. And so what do we do to make her happy? We read some correspondence from our clients or people who want to be clients. And therefore, we're going to start with a guy named Peter. And Peter has said, let's see. He says, "Hi, Doug. Thank you. If I ever want to change I told him that his United United American Medicare Supplement High Deductible Plan G was approved, and it will be in his mailbox. His policy and his ID card will be in his mailbox within a couple of weeks." He says, "Thank you. If I ever wanted to change the United American policy for higher coverage, meaning Plan G, more expensive coverage, is that possible?" And my answer to him, absolutely. You are allowed to initiate this type of change anytime you wish by filling out a health history questionnaire that is acceptable to the company underwriters. The question is, will you want to? When compared to the very rich Plan G that you might move up to, that plan has a tendency to have a larger rate increase more frequently. This means that every Plan G rate increase that happens makes your premium savings larger and your high deductible Plan G more valuable. Someday, your premium savings will grow to equal the amount of your annual limit, and then you'll be better off financially with the high deductible plan under all circumstances, rather than having to pay a large monthly premium to Plan G. I hope this helps. And Peter responded, got it. Thanks. We'll stick with it. And then I've got some correspondence from a person who is a minister. I forget what church he is. He became a client about 4 years ago. He lives in Missouri, and dealings with him have been very pleasant, but we don't cross paths that often, as this is the same with most of my clients. They just don't have a lot of reasons to get in touch with me about questions or problems. So he wrote, hello, Doug. I plan to stay with Mutual of Omaha supplement high deductible Plan G as you recommended 2 years ago. Last year, you suggested that I change drug plans, which we did. I'm still not taking any prescription medication drugs regularly. My blood chemistry is well balanced and I am in strong physical health. I actually don't recall which prescription drug coverage I currently have, he says. Should I allow everything to automatically renew on December 7th for 2026? And my response to him was, hello again. I don't know whether to call him father or his first name or what the heck. So I said, hello again. My records indicate that 1 year ago you were enrolled in the WellCare Value Script drug plan. A little research shows that it will be the least expensive plan available to you in 2026, so you probably should stay put. It will renew automatically. Next September, the plan will send you a document that will inform you whether it's likely to change in the following year. That document will tell you everything you need to know about whether or not to keep it or dump it. It is called ANOC, A-N-O-C, Annual Notice of Change. Have another good year. And he wrote me back and said, you do the same. And then finally, we have correspondence from Ray. And Ray says, I have a couple of questions about Part D, my prescription drug plan. Number one, when I log into the Medicare website, I can see my WellCare Value Script plan starting December 1st, along with a temporary card. Is it correct to assume that WellCare will be mailing me a card shortly? Number two, does my Part D plan automatically carry over to 2026, or do I have to do anything for that to start? And I said yes to both questions. That confirmation I sent has a telephone number to call if your ID card does not arrive in the U.S. mail within a couple of weeks. The drug plan will renew automatically for 2026, but a year from now, watch your mail for the ANOC, the Annual Notice of Change, to make sure the plan doesn't intend to turn into something you would prefer not to have. So that was Ray, who was a new client recently. And now I'd like to stump the podcast director. What are you? You're the engineer, the podcast coordinator,
Godling,
the podcast godling. I would like to stump him, but I don't think this is going to be that exciting. I thought I had a quiz around here that I was going to be able to stump you with, because turnabout is fair play. I always believe in fairness, and I figure if somebody kicks me in the teeth, I'm going to do it right back to them. So
that's right. That's right.
So all I can do is basically, oh, yes, this is the quiz. It just has multi-pages. So we'll be boring the audience for another hour and a half while we get through this quiz. The best and worst.
Go grab a coffee, folks.
The best and worst U.S. states for healthcare costs. And this, healthcare costs, a lot of people confuse insurance cost with the cost of treatment by doctors. And I think this is healthcare cost is used correctly here, meaning the cost of medical treatment. So the overall U.S. healthcare system received a C grade from a broad survey of U.S. adults. I say those people are a bunch of whiners and complainers, because I believe that America has the finest healthcare system in the whole world. When you look at some of these European countries that have health systems that are for, or like the Canadian system, they're basically socialized medicine. And there are a lot of unhappy people in a socialized medicine situation. So this is a scan by Gallup, a survey that says, okay, which states are the most expensive and which states are the worst, the most expensive versus the least expensive. And I'll bet you that you can't pick out the one state that out of the 51 jurisdictions that they say is the best for cost of health care. And
Best as in cheapest?
yeah, apparently so. They give some, I didn't want to read all of this falderall they have in defining their categories, but they do, overall, there's an overall letter grade, and it's made up of the cost, the quality, and the access. Now, in America, we can have access to anybody we want to go see, but you can't have it under a government health insurance plan without paying a little bit for it. And when half the people on Medicare have a Medicare Advantage plan, those people are limited. They can't have access to everybody that they should have. Only people buying Medicare supplements from insurance agents like me. So access is one criteria. Quality of care. Well, if you don't think you're getting quality from one source, you're free to go to another source if you've played your cards right. And then cost is the third element here. So there's an overall letter grade. And I'm asking you, which state do you think has the highest overall rating for cost, quality, and access?
Massachusetts.
Oh boy. See, I wanted to throw you off the track a little bit. The state is Iowa.
Iowa?
Yeah, I know. Hard to believe. But the second is Massachusetts. So I know that there's some cheering and foot stomping going on out there in Massachusetts as this episode is being played. So Iowa is the best state in the country, but it only gets a C plus. For cost, it gets a D plus. For quality, it gets a C plus, and for access, C plus. I don't know what the heck Gallup is doing.
So now I'm really confused. If that gets you the best in the country, then what's the worst? There's no doctors in the state, or what?
Let's turn a couple of pages and find out. You could be right about that. The worst, Alaska.
Oh yeah, there's no doctors up there.
Just bears, ravenous bears.
Yeah, there's bears, and one of the things you always hear about when you go to Alaska is every year how many people the bears get.
Yep, and they're not losing weight. So now the second worst state is Nevada. So I don't know what goes on in the nether regions of Nevada. I know I've been in Las Vegas a whole bunch. I've driven through the state. I'm inclined to think that maybe it's the rural areas of Nevada that are poor. New Mexico is the third worst. And then they have Texas as being very, very close to the bottom of this list. And after that, Vermont, Delaware, and Arizona. Holy crap, we're all going to die. So I really don't have a whole lot of faith in the quality of this survey, and just like they don't have any faith in the quality of the U.S.
Who was surveying? Who's surveying?
Gallup.
Yeah. Gallup needs to, maybe rethink they need to rethink how they gather information, I think.
Why don't we close the door on Gallup and maybe close the door on this episode?
Yeah, I think we're going to have to, because, they're already dinging in my ear that we've overstayed our quarters. So we need to go ahead and close up shop. But before I do, as always, there's some really important stuff I share with you at the end. Number one is grab a pencil and write down this email address. It could be the most important email address you're going to pin to your refrigerator maybe this year. dbj@mlmmailbag.com. You can reach out to Doug during the day or night because he monitors it 24/7. dbj@mlmmailbag.com. Doug is licensed in every state of the union to help you with your Medicare supplement choices. MEDICAREforthelazyman.com. That's the website. Lots of good stuff going on there, if I do say so. In your wanderings through the wilds of the internet, drop some reviews for us. We want to stay ahead of the travel log, people. And last but certainly not least, never last and never least, thank you. Thank you for joining us today. You could have been anywhere else, and you weren't. You were with us listening to Medicare for the Lazy Man podcast. And obviously, you need to know for your time, basically your time usage, how much time you spent with us today. Well, you just spent about 32 and a half minutes with Doug Jones, the anti-insurance guy, originally from Oklahoma. No more, he's back home in the high ground behind Cave Creek, Arizona, in the Nosebleed Mountains. And I'm going to put him in. I always check before we end up the podcast. I always check. I'm going to give him a break today. 6,000 feet.
6,000 is better than the 8,000 you had me at before. So I'm going to hang in there because maybe I'll get down around sea level someday. But in the meantime, I wanted to make one final announcement. Those prostitutes at the University of Arizona have named their stadium after a casino. They've sold the naming rights of their football stadium to the Yaqui Indians. And I can't find the name of the casino, something Del Sol. And so it's going to be a 6-word name of the stadium now. It'll never be U of A Wildcat Stadium anymore.
Well, it
20 years.
Used to be Bear Down Stadium.
Well, that was an indoor stadium. That was on the roof of a 1920s, it looked like an airplane hangar. And the football stadium was the one they built over on Cherry that is all concrete. I mean, it looks like it's freshly poured concrete. Do you remember that thing at the kind of the eastern end of the campus?
Well, obviously, my daughter graduated from U of A, so I spent many, 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 many hours down there.
Many hours and many dollars.
Yeah, and I was acting as a pack mule most of the time. But bottom line is, I don't remember the area you're telling me, but I'll have to do a little bit of research.
Okay, well, if you stood in front of Old Main, that 200-year-old building, and faced east, you would see this giant concrete structure far, far off in the distance, and that's the stadium. They're naming it the Casino del Sol Stadium. Somehow the Yaqui Indians got them to say, we'll give you some of our casino money, and you guys can carry our name for us. So anyway.
I think we might want to, let's go down and outbid them. Medicare for the Lazy Man Stadium.
Stadium, sure, absolutely. Doug and Randy's Medicare for the Lazy Man Stadium.
Wouldn't that be cool? Just one day. I don't need it for the whole year.
Well, that couldn't cost more. We've got a bunch of extra quarters laying around somewhere.
Yeah, exactly. I was kind of hoarding those for the Christmas party, but that would be good.
Thank you very much, ladies and gentlemen, for joining us. We're hoping that you'll come back again. I don't know. The odds are slim, I would think. But if you've got the courage, then come on back for our next episode. We'll look forward to seeing you then. Bye-bye.